Hello, and welcome to the IBD School 800 series. My name is Michelle Muza-Moons, and I'm an IBD specialist at the University of Michigan. In this video, IBD School 807, we'll talk about the risk of getting a flare of IBD after delivery during the postpartum period of a pregnancy. For this video, we will consider the postpartum period of a pregnancy to be the first 3 months after delivery. For both patients with Crohn's and patients with ulcerative colitis, the risk of a flare of IBD goes up during this period after delivery, especially for ulcerative colitis patients. Ulcerative colitis patients will be about 3 times more likely to get a flare after delivery, while Crohn's patients will be almost 2 times more likely to have a flare in the postpartum period. Research has not yet specified a reason for why this is, but it seems likely that this could be caused by the large change in hormones after a woman gives birth. During pregnancy, women have high levels of circulating estrogen and progesterone made by the placenta, which are steroid hormones and cousins of prednisone. When the placenta leaves the body, the levels of these hormones fall rapidly, like stopping prednisone suddenly without tapering. The stressors that come with being a new parent and taking care of a baby are also likely culprits for the increased chance of having a flare during the postpartum period. Things like sleeplessness from staying up all night to care for a crying newborn, or the stress on the body caused by breastfeeding, may lead to higher chances of getting a flare of IBD. Additionally, if a Crohn's patient has had a vaginal delivery, they will have to be careful to monitor the healing going on in the perianal area after birth. There is a higher risk of fistula formation and complications while this area is healing from a birth, especially if they had an episiotomy. This is why many patients with IBD elect a cesarean birth. However, depending on the type of IBD you have, you may be better suited to handle a vaginal birth. For example, patients with Crohn's disease without fistulas or patients with ulcerative colitis who have intact intestines can usually handle vaginal birth quite well. Post-delivery, all patients will also be at a higher risk for birth-related complications, such as blood clots. After giving birth, your response to your IBD medications and other medications in general may be different than you are used to. Some patients find that after giving birth, a certain medication isn't working nearly as well as it used to, or a certain medication is giving them strong side effects they did not usually have. If this is the case, your doctor may prescribe more medications or different medications in order to improve your IBD and your symptoms. Your CRP levels will also drop after you give birth very quickly. During pregnancy, patients' CRP levels tend to go up, treating pregnancy as a kind of inflammatory state. But once a baby is delivered, these CRP levels will go down rapidly. In general, after you give birth, some of your medications will need to be readjusted if the dose of that medication is based on weight. For example, if your azathioprine dosage was adjusted due to a weight gain during pregnancy, your doctor will need to adjust your dose fairly quickly to respond to your new postpartum body. If you stopped anti-TNF therapy before delivery, a decision which is discussed in IBD School 804 on medications in pregnancy, we will recommend that you restart it very quickly after delivery in order to avoid a postpartum flare. Many women are better off continuing the anti-TNF through delivery to provide the best control of inflammation and avoid the risk of forming antibodies to medication. If all your original medications were carried through the pregnancy, then you shouldn't expect any change after you give birth. Continue to take all your medications in order to keep your inflammation under control. When it comes to IBD and pregnancy, taking care of yourself is the most important thing you can do as a parent. It's also one of the most difficult. In order to best take care of your child, be as careful with your health as you would with your baby's health. To help keep your stress and disease under control, do small things like asking other family members or friends for help with the baby. Try a hybrid method between breastfeeding and bottle feeding. Or if you have the means, hire someone to help you care for the baby at night to allow for more sleep. All these actions can help you monitor your disease, get more sleep, and put your health first, which will be important for both you and your baby during the postpartum period. I'm Michelle Muza-Moons, and thank you for watching IBD School.